All right, welcome back to Functional Neurotalks. My name is Elena. This is Dr. Gabella, and we have a new person on today.
I'm Victoria. I'm the office manager.
Hey, Victoria, it's good to have you on here. All right, so today we are talking about a subject that has been kind of getting a lot of traction on social media, tinnitus. So a lot of people think they know a lot about it, but turns out not really. So Dr. Gabella, I'll let you take this away.
Absolutely, and we're kind of learning it's becoming a little bit more common, and people are struggling to figure out where it's coming from, why they have it, and what they can do. So we're going to try to cover some of the bases today. So I think some of the common myths that Elena kind of brought up are that it's not just an ear or hearing issue. More common than not, we actually find that it ends up being a brain issue. It could be caused by many different things, and people can describe it quite differently. So sometimes people feel like it's ringing in the ears, it's constant versus it comes and goes, the intermittent component. Sometimes it's pulsatile in nature. Those are the ones we're a little bit more concerned of, and we want to go rule out that there's not a vasculature problem. Going to an ENT is a really good first stop to figure that out. And then once you realize, hey, it's not coming from any vasculature issues, when we think pulsatile, we're always going to think vasculature. So with anything in nature, sometimes people will feel it in their ears, they'll get it in their head, things like that. We want to go ahead and rule that out, make sure there's no stroke risk and things like that. But yeah, so tinnitus is different for everybody. I think that's maybe the little confusing part of it. The other thing we also see that we'll get to towards the end is the component of the emotional, the irritability, the anxiety that comes along with tinnitus. Some people will have tinnitus, it doesn't bother them at all. Other people will have tinnitus and it'll really bother them. So on a basic standpoint, if we rule out any issues within the inner ear and the hearing apparatus, which is delivered through our vestibular cochlear nerve, we know there's no pathology in there. We have a loud blast, near our ears, or if you go to a gun range often, combat, we see a lot of these explosions and things like that where they do end up rupturing their eardrum. So that's where we're talking about an inner ear issue. Once we've ruled those things out, we're looking at, hey, what's going on in the brain? The reason being is we have our sensory mechanisms. Hearing is one of them, right? My vision is one of my sensory mechanisms. I take in my world and then my brain responds, right? And my brain responds because neurons are going to respond once that sensory stimulus comes in. So then we're going to think, so where in the brain is sound heard? Like where is our auditory cortex? So the auditory cortex, we're going to use this little diagram right here, is in the temporal lobe, and the brain might fall apart on me here, so just bear with me. This little area is called the temporal lobe. We obviously have two temporal lobes, one on the right and one on the left. So this is the back of the brain, this is the front of the brain, and we're looking here at that inferior lateral aspect is that temporal lobe. Temporal lobe is so important. So one of the reasons why it's important is it has our auditory cortex. So every sound that we're capable of hearing or perceiving, it's going to have a group of neurons that respond to that pitch perfectly, and we hear that sound. Well, there's billions of sounds that we hear. As I'm speaking, you guys are hearing a specific sound that's very individual to my voice, but it's because, let's say, 100,000 neurons are firing at the same time to create the sound that you hear. So if I'm hearing tinnitus, if my ears are ringing, and it can be called tinnitus or tinnitus, exact same thing. So depending on your world, so we've had that question. Both of them are correct, okay? And what that means is that you're having ringing in the ears, right? The perception of ringing. And it may not even be a ringing sound. Some people, it's like this very deep, dull sound, or it could be crazy high pitch. So it can be very different for people. But what we're looking at is we're saying something in the brain is spontaneously firing, because we don't just hear or feel things unless neurons are firing in the brain to create that perception of a feeling in the body. So what that also means is something's happening in my brain to cause the spontaneous firing. And so what's happening is that a lot of people kind of get freaked out because you think, oh my goodness, are my neurons dying? But that's not the case. Before neurons die, which we lose neurons every single day, so it's a common thing, before they die, they spontaneously fire. So what that means is normally my neurons stay at a resting potential. Elena has to touch me for me to feel something, right? But if the neurons in my brain that innervate the sensation of my legs, or that respond to the sensation of my legs, spontaneously fire, I start to feel something in my leg without anybody touching me. Same thing with the ears. I start to hear ringing in the ears without sound actually coming in because the area of my temporal lobe, auditory cortex, is spontaneously firing. So then we go back, like, how can we treat this? There's two fields of thought. You either treat it with the exact stimulus to match it, right? So you try to find a noise generator and you try to match the frequency the patient is hearing, and you play that so that that sound itself activates those neurons that are unhealthy, that are spontaneously firing. It gets them to become healthy again. When I say healthy, there's a lot going on a cellular level. We got to remove inflammation. We got to get that electron potential back to a normal gradient, and a lot of that has to do with calcium, sodium, potassium, things like that. And we got to heal so those neurons get better and get healthy. And then they start to go to rest, and now it's going to require an appropriate amount of stimulus to come into the brain for them to fire and respond. So I'm not hearing that tinnitus, right? The second field of thought is that we're going to take an attenuation approach, which is a little different, a little controversial too, but every patient is different. That's the other thing to consider. When you have tinnitus, that doesn't mean your brain looks similar to somebody sitting next to you that has tinnitus. It looks very different. So if somebody goes to get treatment or they try it at home and they're trying to treat the tinnitus and they're trying to match that frequency that they're hearing, their ears are ringing, they're matching it, they're activating that neuron group, things aren't going so well. The second approach is to basically cancel, to activate every other auditory neuron that is not matching your frequency of tinnitus so that other neurons fire louder. So when the other neurons, so it's hard to kind of explain because we have to kind of like make up this hypothetical. Let's say it's a 100 hertz frequency that these neurons are firing at. You're going to activate everything else other than 100 hertz so that the other sounds are firing higher and your brain no longer perceives that 100 hertz frequency. We kind of practice in the office, we always approach it as, I don't want to make a compensation mechanism for the patient. I want to treat the underlying disorder and get them as healthy as possible, versus the other approach is sort of like, I'm gonna activate something that's really healthy and just not worry about the unhealthy area because I'm gonna create a compensation mechanism for them. And so that's important to understand, because if you've been dealing with tinnitus for like 20 years, driving you crazy now, feels terrible, that's a wonderful option because we don't want you to go crazy, right? We don't want you to suffer. So if the viability of activating those neurons that are spontaneously firing isn't there, let's build you a compensation mechanism. Totally makes sense.
Okay, so let's just do a quick recap. And honestly, when I first started working here, like, I really didn't know that much about tinnitus because we normalize it so much in the day-to-day life. Like, everyone has it. I know I have it sometimes. Victoria,
I get it all the time.
You do? Yeah. And I
gotta treat these girls.
Yeah, I know. And yeah, we just didn't realize that it could be coming from the brain. Like, I didn't even know that there were different pitches. I thought everyone just heard the same type of ringing.
Yeah.
And with the pitches, does the quality of the pitch tell us something different about the brain? So like if you hear it at a lower pitch or like that more muffled sound, is that different from someone hearing it? Like I get a really high pitch.
High pitch. Yeah, so what it's saying that those neurons that respond to high pitch are what's spontaneously firing in Victoria's brain, whereas somebody else that's a duller pitch, it's going to, and the interesting thing about that is we're making it sound like it's like 5 different neurons, but it's thousands, hundreds of thousands of neurons that will respond, that'll fire at once and create a certain sound. And so when you're playing with those apps, it's actually quite hard to really nail that frequency because there's just so many variables into what we're hearing.
Right. Okay, so we've said that it could be an ear issue, but it could also be a brain issue, which a lot of people don't know about.
Right.
And then we also briefly touched upon like what happens in the brain. So it's coming from the temporal lobe when it is coming from the brain. and then that treatment is an option. No one ever says that.
Right.
No one ever tells you that.
Yep.
So people think you just live with it. And yeah, you're right. People do end up going crazy. I didn't realize that some people hear it 24/7. For
Yep.
me, it comes and goes. But yeah, that's insane.
So for the girls, they both are
Yes.
saying, hey, we have tinnitus, it comes and goes. The first recommendation, young, viable brains, it should be easy to fix and respond quickly, is to download any of the tinnitus apps, and there's quite a few. I think you could probably type in tinnitus on your app store. And what it's going to look like, it's going to look like a basic noise generator. So you should have some functionality to move and change pitches. It may give you multiple controls, may give you singular control, but what you're saying is, hey, I'm going to move this sound and I'm going to try to match exactly what I'm hearing in my ears. And then when you do match it, it's almost as if things go silent. So for example, my ears are ringing, they're creating specific sound. Once I nail it on the app, it's not going to cancel what I'm hearing, but it's going to feel as if it's canceling it when it matches perfectly. So at first, it's kind of frustrating, it's confusing using those apps, but then once you hit it, you're kind of like, oh, I get it. Like it just feels less, or some people are like, I don't even hear it anymore. So that's what we're looking for. We're looking for that zone of like, I don't hear it anymore. And it's matching that frequency. Those neurons that are creating the sound you're hearing are now getting activated by the sound that you're putting into your ears. Definitely, if you're around other people, I would encourage you to use headphones because you may not hear a certain pitch very well. Everybody around you will hear it, and it could drive them nuts. So definitely use headphones for that.
Yeah, 100%.
And always start low. I just want to say this, like, you're not listening to this for 30 minutes. Like, you're starting 5-minute increments, playing it in your ears, and you can do it, let's say you do it 5 times a day, and kind of say, hey, is my tinnitus getting better, worse, same? If you start noticing the more you're playing it in your ears and it's getting worse, I wouldn't continue it, because of the fact that you're kind of functioning solo without a healthcare provider overseeing what's going on.
Right. And another thing to note is that it is very common for your tinnitus to change. So the sound will change, and that's good. That's what we were looking for.
Yes, absolutely. Yep, really. That's really good to bring up for sure.
So, question for you.
Yes.
What happens when the tinnitus is coming from someone's brain and they leave it untreated for a really long period of time?
Yeah, that's a really good question. And then I'm going to tie into that what I had mentioned earlier. Sometimes it's really frustrating for a patient that has tinnitus that is causing significant irritability and frustration and just hopelessness. So that patient, it's firing into their limbic system. And the reason being is we have a lot of relays from our temporal lobe area that's going to fire into the limbic system. The limbic system is the control of emotions, okay? So here they are, their whole life is upside down. There's so much suffering every time they hear the sound, and then they talk to somebody else and they're like, yeah, I've had tinnitus for 20 years, it doesn't bother me. Like, I have no problem with it. Like, it is what it is, no, I have no issue to treat it. Very different brains. So the person who doesn't have the emotional component, it hasn't made its way into the limbic system to create it, right? So the person that does, obviously, you're not losing your mind, and there's more of a motivation factor to get treatment because we don't want to suffer, and there's consequences with that. That limbic system is a very survival, it's a more primitive system. It fires to a lot of different areas of the brain. We want to keep that nice and healthy. The next thing I want to mention is the interplay within communication from this temporal lobe area to our hippocampus. So our hippocampus is really such an important area of the brain to know and to understand on a basic, simplistic level. The reason being is it is our memory center. So our memories create who we are as people. It creates our personality. You go through life and you go through lessons and you learn these different things and you become a certain person. If you start getting deterioration in this area, and we see in all different diseases that it happens, it's not going to be good, okay? It's what makes us human. Super important area. It's also a great area that we can increase stem cell production, neurogenesis in this area, and I've kind of brought it up in some of the other conversations with exercise, aerobic exercise, things like that. So it's our working memory, it's our long-term memory, it's our short-term memory, because it's all this stuff it's involved in that processing. We have a large memory center that's in our temporal lobe as well. So when we're looking at Alzheimer's, dementia, these neurodegenerative diseases, they degenerate in your temporal lobe. We don't want to see that. So not to say that somebody that has tinnitus is going to progress into that, but it puts you at a higher risk. So we want to treat the tinnitus, we want to treat your memory, and we want to treat that hippocampus. The other thing, hippocampus is not just involved in memory, but it's involved in emotionality. Think about all those moments of your life of joy or fear or anger. Guess what? You have all those high emotions, you remember that perfectly. If somebody breaks into your house and steals something, your memory of that event is so high, right? So the memory is hippocampus, limbic system, amygdala, and a bunch of really cool other areas that are involved in that. Emotionality, when we see anxiety, when we see a lot of frustration, irritability, we're worried about that limbic system. So both patients, the one that's bothering more of a priority to get treated. Not to say the other one is not having major memory issues, cognitive decline, and shouldn't get treatment, but they should. And so what was that question, Elena?
So I was asking what happens when it goes untreated for long periods of
Right.
time.
So everybody's a little different. So we can't say like, hey, if you have tinnitus, get it treated. It's going to cause, neurodegenerative changes, or it's not going to be good for you. But some cases it will do that, and it's not going to be good for the other cases. They may have it their whole life, and they don't have any symptoms to be concerned about. One thing I would look at, make sure your cognitive function, your memory, right? Short-term memory is what we're most concerned of, meaning what did I eat for breakfast yesterday? What did I have for lunch 3 days ago? That memory system is what we want to keep sharp, and we want to make sure that it's nice and intact. And if it isn't, we want to get treatment.
Tell them about the smell thing.
The what?
The smell thing.
Oh, good. Yeah, that's excellent. I totally forgot.
That blew me away.
Yeah, so we also have the olfactory cortex in our temporal lobe. So being able to identify smell, we actually have the Philadelphia smell test that we use to diagnose Parkinson's like 30 years in advance before you actually have the tremor, at least like 15 years in advance. But we really want to be concerned about smell. How is a patient's smell doing? Not just like, can you smell this? Can you identify it? But the most important thing is to start comparing from side to side. So to plug a nostril and breathe in one side, and then plug a nostril, breathe in the other side, and to be able to say, how potent does that smell? So as long as I don't have like a sinus infection, it should be equal bilaterally. You'd be amazed how many people that have issues within that temporal lobe, side to side, their smell is not as accurate, right? So looking at the smell is huge.
Yeah, in our exam we have peppermint oil, and it's crazy how many people do not know what that is.
Yep.
They're smelling it and they're like, I can't
They're
put
like,
my finger on it.
So you'll ask them, hey, do you have changes in your smell? They're like, no, I think it's normal. Then all of a sudden you go to test it, and it's significantly different from side to side, and that's a big deal. That's telling us what's happening within that olfactory cortex and that temporal lobe. So it's all interconnected. And it's important when it comes to memories and emotion. We also know, it's another cool little side note, people that have like severe Alzheimer's and dementia, sound, music, you can play music and it brings this person alive because they have memories stored really strong with sounds and music that will bring their younger self to the surface, right? This is a person who doesn't recognize family members anymore. They've really lost their mind. They're very deteriorated. You can do the same thing, elicit the same thing with smell to bring back their old self, those old memories, so that they're like a little bit more cognizant, they're more with it for a short period, which is beautiful.
Speaking of music, if you rule out that your tinnitus isn't coming from the ear and it is a brain issue, is ear protection still important? So if I'm going to a loud concert, should I
For sure, yeah, for sure. That's a really good point. I actually don't typically recommend that as much as I should. I think most of the time, by the time patients are in here, they've kind of done a little bit of research about what's going on, they typically will wear ear protection. But specifically, like if you're at a gun range, whether it's indoor or outdoor, definitely need to be wearing excellent ear protection. If you're by anything that's super loud, the concerts, things like that, I would for sure, because it's a difference when you're way far back in like an open field versus right up on top of the stage. So it is really good because unfortunately, a lot of times when you do have tinnitus, there is an emotional component. So it adds to the anxiety and fear and worry that, just not worth it.
So when it is an ear issue, can it progress to become a brain issue as well?
For sure. That's a really great question. So same thing with like vestibular disorders that are coming from the peripheral ear. If they go untreated, they're creating a central imbalance, right? So regardless of where it starts, like even peripheral neuropathy, it's starting in the periphery, it's not starting in the brain. It's going to have a brain consequence because we lose that afferentation to the brain. Same thing with the tinnitus. If I have a blast injury and all of a sudden, and generally with these injuries, you're going to have decreased hearing, and then you're going to have the tinnitus on top of it. So you're getting crazy mixed signals to that temporal lobe. There is going to be issues going on. So I do suggest treat your brain. You may never be able to change the peripheral consequence if it's ablative. You know, you've had something happen with that eardrum, but you could absolutely keep your brain healthy otherwise.
That's a really good point.
Yep, for sure. That's a great question.
All right, so I guess, yeah, that's most of what I have,
Yep.
honestly. I would say one more thing I would like to ask you would be like, what, how can people get tinnitus when it is a brain issue? So like, we know about the noise consequence, but what about like medications or different sicknesses?
That's a great
that
question.
kind of
Yeah.
thing?
So, you know, that's the hard thing when it comes to brain is that we can't really ever know the one thing that caused it. And generally, it's never a one thing that causes issues within our brain centrally. It's accumulative, right? Because our brain has to be really good at compensating. So I may take a medication in my early 20s, and let's say I took it for 3 years and then I come off of it, and you know, 2 years later I develop tinnitus. I'm never going to connect, hey, that medication changed the way my brain works. But if it's a psychoactive medication, if it's an antidepressant, anti-anxiety, muscle relaxants, neuroleptic meds, you know, there's just so many different classes that have an impact on your neurotransmitters. So if we know it's changing the neurotransmitters, we know it's binding in the brain, we know it's going to have a neuroplastic change in the negative direction, meaning it's going to change the connectivity within the brain. That's not optimal, right? So it's hard because our brain is really good at compensating. So that 5-year gap, my brain didn't show that I had symptoms. So 5 years later, when it comes up, I'm not really sure where it's coming from, right? So it could be medications, it could be concussions, it could be inflammation, it could be our diet, it could be so many different things. Stress, yep, environment's huge. Environment's huge. And one thing that is such a incredible field that I really encourage most people to look into is epigenetics, and understanding that our environment is constantly having an impact on our gene expression for good and for bad, right? So if we want healthy genes, if we want more connectivity in the brain, we want to do things that is creating a more healthy environment. And it's both from a mental standpoint and also from like a toxin standpoint, eating healthier, eating cleaner. And all within moderation, right? Nothing works when it's extreme. These extreme diets are crazy, you know, it doesn't work. Like, and it's not overall healthy for the whole entire body. So, yeah. That's my input.
Yeah, I like that because I hate it when I'm scrolling on social media and you see all these health gurus and you're so extreme. I feel like I'm doing everything wrong.
Yeah,
and it's
for
so
sure.
stressful.
For sure.
Yeah.
And I almost guarantee you, if they go in and they actually get a full assessment on how healthy they are, they're not really that healthy. So anything that's extreme, I would say kind of like avoid it. You know, the human body works best with moderation, and we know how to be smart, you know, and we know like eating healthy foods and natural stuff and less processed and things like that is way better. And it's those decisions that I think make a big difference.
Definitely.
All right. I don't have any more questions. Victoria, do you have anything to add?
Good.
Do you have anything to add?
No, I think we're good. I think this was a great talk.
Yeah. Well, that sums it up for today then. Yeah, I guess that's all we have for you today. Make sure to follow us on social media and stay tuned for the next episode. We'll see you later.
Yep. Thank
Bye.
you.